Good afternoon. My name is Tammy Klein, and I am honored to serve as the president of the Oregon Nurses Association. On behalf of the 16,000 represented members across the state, thank you for joining us today at this press conference. The last 5 days have been truly historic, and not only because of the first strike in Oregon in more than 20 years. My colleague and friend Richard will have more to say about that in a moment. At the ending of the 5 days, Providence strike is just a few of the moments. As I said, the last few days have been historic for other reasons too. Last night, Oregon House Bill 2697 passed both in the House and in the Senate and is on the way to Governor Kotek's desk. After months of negotiation with the hospitals and legislatures, followed by a powerful House hearing in February where nurses and allied healthcare workers testified for hours about the Oregon's ongoing nursing crisis, and a 6-week Senate Republican walkout denying quorum to pass bills, all of which followed years of mistreatment of nurses and allied healthcare workers by hospitals, has brought us to this point. House Bill 2697 is vital in fixing Oregon's collapsing healthcare system. It will put numerical minimum staffing ratios for nurses and CNAs to patients in hospital settings by unit. It will expand Oregon's staffing committee structure to include service, technical, and professional allied health care workers. It will require that the state to enforce the staffing law, including for violations of ratios, failing to release the worker from the shift to participate in the staffing committees, and denying workers their meal and rest breaks. Hospitals must comply with the nurse-to-patient ratios on June 1st of 2024, and the new staffing committees must be in place before December 31st of 2024. Increased mandatory state enforcement begins June 1st of 2025. This fall, ONA will engage in rulemaking with the Oregon Health Authority and the Bureau of Labor of Industries to guide them in implementing some of the most complex elements of this bill. And between now and when the ratios and new committees of the HB 2697 take effect next year, we will be training our staffing committee members to transition towards implementing those provisions of the bill and the staffing plans. Once the bill takes effect, we anticipate that some of the hospitals will still try to skirt around the staffing law. So Oregon Nurses Association will be vigilant, and we will hold hospitals accountable by filing timely complaints to the Oregon Health Authority and ensuring that the agencies enforce this law. For today, Oregon's nurses and allied healthcare workers should celebrate the passage of this historic legislation. And for those of you listening, today is also a day to connect some dots. Safe staffing is at the heart of the single thing for ONA. It is our organization's principle, the focus of our work, and our primary goal. The victory at Oregon Legislature is only one piece of a much larger effort, and that effort includes our work and bargaining tables across the state. Safe staffing was at the core of the contract success at St. Charles Medical Center in Bend. It is at the heart of our fight with Peace Health in Eugene and in Springfield. It is the focal point of 3 informational pickets that will take place next week in Portland, Hillsborough, and Astoria. It is the singular focus of the nurses at Providence who are ending their limited duration strike today. It is the most important issue facing nurses, and to be completely frank, facing health care in the United States today. ONA will not back down, and we will not stop fighting for safe staffing. Now it is my pleasure to introduce Richard Botterill, who will deliver a few remarks on the end of the 5-day Providence strike. Richard.
Thank you, Tammy. Good afternoon. My name is Richard Botterill. I have been an emergency department nurse at Providence, Portland for more than 12 years, and I'm currently the chair of the Oregon Nurse Association Providence Portland Executive Committee and Bargaining Team. I join you today on behalf of 1,800 striking nurses, physical therapists, occupational therapists, speak language pathologists, social workers, and bereavement counselors from Providence Portland Medical Center, Providence Seaside Hospital, and Providence Home Health and Hospice. In just a few hours, the first nurse strike in Oregon in more than 20 years, and the first ever such strike against Providence facility in the state, will come to an end. But our fight is not over. It has just begun. My 1,800 colleagues and I did not undertake this strike action lightly. We are nurses and clinicians because we want to care for our patients. We want to practice our profession, we want to heal, and to ease the pain of those who suffer. We want to comfort those who are dying and soothe the families of those who have passed. We want to help bring new life into the world and support those who are recovering from life-changing illnesses. We want to care for our patients. Without a doubt and without a question, we did not want to go on strike. But we cannot do our jobs under these conditions, and Providence knows it. All the meetings and documentation, all the evidence and petitions, all the research and speeches and pickets and rallies, all the letters to the editor and private discussions in the hallways, all of the begging and pleading, all of the press and community outreach, none of that moved Providence to do the right thing. None of it. So we went on strike. We went on strike to save lives, and our strike has been an unequivocal success. We have raised awarenesses within the community about Providence's failure to provide staff with adequate paid leave to care for ourselves and to our families. We have highlighted the many, many ways in which Providence fails to ensure safe staffing for their patients, and how that failure overburdens caregivers and leads to poor patient outcomes. We have corrected Providence's erroneous and intentionally deceptive claims that nurses are just in this fight for the money, and explained to the community why competitive wages, affordable health insurance, and access to mental health care are key to the recruitment and retention of staff. We have pointed out Providence's hypocrisy, their failures of leadership, and have made clear to the public what is at stake in these negotiations for us and for them. More than that, we have seen historic solidarity between the 3 Providence units on strike and all of our co-workers throughout Providence, and for that matter, throughout the state. We brought more than 1,000 people together for our first day of strike rally, one of the largest union actions in the state in over a decade. We received support from elected officials at every level of our government, and proven time and again that Providence cares more about profit than it does about patients or providers. Now, with the end of the strike looming, we are even more committed to reaching a fair contract with Providence together. ONA is inviting Providence back to the bargaining table as soon as possible to continue bargaining. In fact, my colleagues from Providence Home Health and Hospice have negotiations scheduled for this Tuesday. We will be firm in our commitment to our core issues, and we will do so with the power of our successful strike action behind us. Our power at the bargaining table comes from unity, and there is no doubt that Providence sees and understands that they cannot dismiss our strength or the strength of the support we have received from the community. Healthcare workers have a special bond. When you are working every day with life close up and personal, there is a closeness that develops between the caregivers. We get to see tragedies, miracles, things that are challenging in so many ways, things that are hilarious, and everything in between. And sometimes we see all of that in the space of 2 or 3 minutes. I thought that bond and unity were pretty special before this past week. What has happened is that it has grown and the bond has strengthened and spread across all of us who care for our community. It's bigger than just the nurses. And I do want to especially thank all of those in our community that have supported us. I think I can speak for all of us when I say we are humbled and blessed. I have never been more certain that we will get a fair contract. Thank you. And now it is my pleasure to introduce Ann Tam-Piazza, the Executive Director of the Oregon Nurses Association.
Thank you, Richard, and congratulations to you and your colleagues on a powerful and successful strike action. Over the past few days, Providence has spoken often in the press about the replacement workers that they have brought in to provide care while our members were on strike. Providence has proudly declared that they have a replacement workforce poised and ready to go that will step in and take care of the patients that are at Providence, Portland, Seaside, Home Health and Hospice. U.S. Nursing Corporation is the company hired by Providence to bring in the professional strikebreaker nurses during the limited duration 5-day strike by ONA. U.S. Nursing Corporation on its website states that it is the premier provider of job action services in the United States and working with healthcare facilities to, quote, and I quote, turnkey staffing solutions during labor disputes. In fact, Providence Health Services has proudly proclaimed that they have hired over 475 professional strikebreakers as replacement workers. ONA believes they have done so illegally. Today, the Oregon Nurses Association is calling upon the Oregon Attorney General to investigate Providence Health Services, U.S. Nursing Corporation, and the potentially 475 individual professional strikebreakers they have hired violating the Oregon law. Since 1975, Oregon law has expressly prohibited an employer from knowingly utilizing professional strikebreakers to replace employees involved in a strike. Oregon law also makes it a crime for any professional strikebreakers to knowingly accept a job as a replacement worker during a strike. Oregon Revised Statute, Chapter 662.215 and 662.225 are the relevant statutes, and all evidence indicate that Providence, U.S. Nursing Corporation, and their professional strikebreakers are in violation of these laws. The Oregon legislature has made it clear for nearly 50 years that it is the best interest of the people of this state to support balanced, fair collective bargaining processes and the prompt settlement of labor disputes like strikes by outlawing the use of professional strikebreakers. ONA is not claiming that Providence is forbidden from using replacement workers during a strike. In fact, that is why we provided a 10-day strike notice so that employers can prepare for a strike. But employers are expressly prohibited from hiring professional strikebreakers who travel the country, moving from one strike-breaking contract to the next as a means of making money off labor disputes. The Oregon law is clear. Hiring professional strikebreakers is unfair, it violates the spirit of collective bargaining, and it is illegal. And that is why the Oregon Nurses Association is calling on the Oregon Department of Justice to do 4 things. First, we are asking the Criminal Enforcement Division to open a criminal investigation into Providence Health and Services for potential violation of these criminal statutes. Second, we're asking them to open a criminal investigation into the operations of U.S. Nursing Corporation here in Oregon and determine if they should be allowed to continue to operate in Oregon, considering these numerous possible violations of Oregon law. Third, we're asking the Attorney General Civil Enforcement and Charitable Activities section to investigate whether Providence Health Services, a domestic nonprofit corporation, has engaged in these statutory violations. And finally, we are asking the Attorney General to obtain information related to the individual professional strikebreakers that have been utilized by Providence and U.S. Nursing and refer prosecutions to the appropriate district attorneys in the relevant jurisdictions for every individual who has violated this Oregon law. Providence has had a long history of turning their backs on state and federal laws when it suits them. At the end of last year, nurses from across the Providence system sued Providence for wage theft for illegally taking money out of our nurses' paychecks. This class action lawsuit was filed on behalf of more than 200 nurses across all 10 Providence hospitals in Oregon. The Oregon Department of Justice opened an investigation into the financial practices of Providence last year related to unfair and deceptive collection practices. And ONA has filed 8 unfair labor practice charges in the last 6 months with the National Labor Relations Board for bad faith bargaining, failure to provide information, and interfering and retaliating against ONA members. And this includes evicting member leaders from their office, confiscating union materials, and escorting those leaders and ONA staff from the building in response to our strike authorization vote. Providence is not behaving ethically. Providence is not acting legally. And Oregonians should stand up and tell Providence, enough is enough. It will come as no surprise to anyone here at this press conference or any Oregonian that nurses are fighting for fair contracts in nearly every corner of the state. Just a few weeks ago, we settled a historic contract with St. Charles Medical Center in Bend, averting a strike. Next week, we're holding multiple informational pickets at OHSU facilities in Portland, in Hillsborough, and in Astoria. We have held picketing in Eugene and Springfield, and we will likely to see similar actions in Medford. As nurses and clinicians, we use our collective power to advocate for our patients, to protect our communities, and to ensure better working conditions. And we do so lawfully. Nurses and clinicians will not stand idly by while employers callously disregard Oregon law. Companies like Providence and U.S. Nursing Corps are fueled by corporate greed. In Oregon, Providence's use of U.S. Nursing Corporation is a way of illegally shifting the balance in their favor, while our nurses and clinicians are fighting for their jobs, their health care, and their patients' welfare. To Providence and other health systems, we say, follow the rules. And to the nurses and other strike breakers, we say, you are not welcome here. If you accept a job as a professional strike breaker in Oregon, you risk criminal prosecution. And as Tammy said at the beginning of this press conference, and as Richard said in his remarks, everything ONA does is in the advocacy of the goal of safe staffing. Our call today for the AG to investigate Providence, our limited duration strike, the passage of House Bill 2697, all of those actions are ultimately in the service of ensuring that our patients get the care that they deserve. ONA will continue to fight at the bargaining table, on the street, in the boardroom, in the legislature, and yes, in the courtroom, if necessary, in support of safe staffing for all. Thank you very much. We'll take a few minutes for questions.
Curious about the limited duration strike strategy. This is the first that I've seen of it. Can you describe what next step would be taken if negotiations don't go as planned? Can we expect to see another limited duration strike? And if so, what are the steps to get you there?
Our commitment right now is to return to the table and to negotiate with Providence towards a fair contract. We believe the strike has been very successful in elevating the work that our nurses are doing, fighting for better patient conditions and for better safe care, and we hope that Providence has heard us.
What will the next step be in terms of the possibility of another limited duration strike?
We have all options open to us as we move forward. Our focus right now is to return to the table and negotiate for a fair contract that our members deserve and that our patients need. Thank you. Thank you very much.
Thank you, everyone.
Thank you, guys.